Hello, my dear students. I'm Dr. Vaishaly Bharambe, Professor Anatomy. Foramen Magnum. After foramen ovale, this is the second most commonly asked Viva question on Norma Basalis. So focus and get this answer out. Remember, if you get asked foramen magnum, answer in detail. Take your time. The more you talk, the less your examiner is going to talk. So if you have foramen magnum, say fantastic and dive into the answer. Okay, how to answer? Come, I'll tell you. So you can see that foramen magnum is anteriorly narrow, posteriorly wide. The narrowness is because of the two occipital condyles coming into the space from the side. This is a diagram which is showing you the same thing. These are the two occipital condyles. Okay. If you draw a line behind them, you can see the foramen magnum divided into a small anterior region and a large posterior region. Let's understand what you will find in the anterior region, what you will find in the posterior region. In the anterior region, you find the alar ligaments attached on either side to the edges of foramen magnum. The apical ligament of dens, question, what is apical ligament of dens? A remnant of. Sometimes you may find the tip of odontoid process also. Upper band of cruciate ligament, membrana, tectoria. These are all structures found in the anterior region. What do you find in the posterior wider region? In the large posterior region, you find medulla oblongata surrounded by meninges and the subarachnoid space. Can you see pia mater, arachnoid mater, dura mater? All of them there. You also find the spinal accessory nerve, the vertebral artery, one anterior and two posterior spinal arteries. See, one here and the other one is here. Sometimes you also find the two tonsils of cerebellum encroaching onto the space from the side. The posterior edge of foramen magnum gives attachment to the posterior atlanto-occipital membrane. The anterior edge gives attachment to the anterior atlanto-occipital membrane. Practice this diagram twice. Practice it twice. Small and on the sides two occipital condyles. Dividing the foramen magnum into anterior narrow region, posterior wide region. Anterior narrow region shows the following structures. Posterior wide region shows the following structures. Okay, come, I'll show you how to revise it. Foramen magnum, anterior small region, posterior wide region. Anterior small region from anterior to posterior shows the following structures. Alar ligaments, apical ligament of dens, tip of odontoid process, upper band of cruciate ligament, membrana, tectoria. Got it? Posterior large region is a little difficult to remember because there's so many structures. So what you do is you divide it into nervous tissue, medulla oblongata, sometimes cerebellum, tonsils of cerebellum, nerve, spinal accessory nerve, arteries, two vertebral arteries, two posterior spinal arteries, one anterior spinal artery, meninges, pia, arachnoid, dura, along with subarachnoid space. It's that easy. Okay, but it is only easy if you use your brain. If you do just random mugging, you're never going to remember this. So use your brain, divide it into small bits and then put them into your brain and get them out at the right time in your Viva. Foramen magnum is one of the most easy questions to answer if you go into it confidently and with a certain amount of study. Remember, such questions benefit you because the more you talk, the less your examiner gets time to ask more questions. Okay, so if you're smart, do foramen magnum well. Students, if you like this lecture, do like, share and subscribe to my channel and remember to hit that bell icon. Answers to all the questions that I've asked you are available in the form of downloadable PDF on my website vbanatomy.com. So I love taking this lecture. I hope you enjoyed it too. Thank you.